So this past week we had an 8-month-old puppy who came in because on a Monday it suddenly started vomiting. And I described to the owner that there's 3 general reasons why dogs vomit. Sometimes they vomit because they're dizzy, because they're riding in a car, or they think they're riding in a car because they have a middle ear problem. This dog did not look dizzy. The dogs who are dizzy have their head tilted and they're walking in circles. So that wasn't this pooch. The second reason why dogs vomit is because there's a receptor in the brain that looks for toxins or poisons. So for example, if a dog goes in the bushes and eats a dead squirrel and gets food poisoning, their body says, this is bad, we should get rid of it, and they vomit. And vomiting a dead squirrel is a good thing. So any external toxin could trigger a vomiting reflex. The other way that the vomiting center gets triggered is by internal toxins. The body has filters, like the kidney and the liver, that filter and get rid of bad things. If those organs aren't working, toxins build up in the bloodstream, and that can trigger a vomiting reflex, which is possible in an 8-month-old puppy who gets into things and eats stuff that they shouldn't. And sometimes young dogs have birth defects where they weren't born with healthy kidney and liver, and we don't know it until they get sick, and we discover that when we run blood work on them. The third reason why dogs vomit is that there are nerves that go from the stomach and the intestines up to the brain, and if those nerves get irritated, it triggers a vomiting reflex. So for example, sticks and leaves and twigs, if they're scratching their way through their intestine, that can trigger vomiting. If something is blocking or obstructing the intestines get stretched, and that stretch will trigger those nerves and trigger vomiting. Sometimes the nerves are irritated not by things inside the intestine, but by disease in the wall of the intestine. So, for example, some older dogs will have adverse reaction to food. Even though they've eaten chicken their whole life, their body doesn't like chicken anymore. Inflammation occurs in the wall of the intestine. If the intestine is swollen, that means the opening gets smaller, it's harder for food to go through, and so now they're vomiting as an adverse reaction to food. When that is severe, we call it inflammatory bowel disease. The only way to diagnose that is with biopsy. And we like to avoid biopsy whenever possible, so while we have to consider it, we save it for the last on our workup. The other way that the intestine can be irritated, those same nerves, so we said from inside the lumen, inside the wall, they can also be irritated by their next door neighbor. And the next door neighbor to the intestine is the pancreas. So dogs who have pancreatitis, inflammation of the pancreas, they're secreting the digestive enzymes that would normally be in their intestines digesting meat. They're leaking these same enzymes into their abdomen, they're digesting themselves. It's painful and it causes vomiting. Okay? So that's the story about vomiting. That's what I shared with this client. And I said, okay, so how likely is it that your puppy has eaten something inappropriate? She says, well, he chews on things, but he never swallows them. I said, well, it's high on my list because he's a puppy. She said, no, not likely. So we decided to do blood work first to look for evidence of external toxins, to look for signs of pancreatitis. And while we were getting those lab results back, we started treating the dog for the symptoms of GI upset. So we gave fluids, we gave antiemetics, we gave acid blockers to see if we could just make the pooch feel better. And it turns out that the blood work came back and it was pretty close to normal. There was a mild increase in the white blood cell count, but no evidence of toxins, and the pancreatitis screen came back negative. And unfortunately, the dog was not feeling any better. It was still not able to eat, and when it did eat, it would vomit. So the next step is that we took x-rays to look for things that don't belong. Oh, by the way, when we palpated this dog's abdomen, I could not feel any lumps or bumps, and very interesting, the dog did not act painful. Many dogs, when we get to the end of the story, would have had a painful abdomen where they splint and say, ouch. This dog never did act painful, which was kind of unusual. Plain view x-rays, everything looked normal on the x-rays. And so we said, we don't know what the cause is, but we're going to continue to treat symptomatically. Another day went by, the dog still wasn't eating and able to keep food down. So at that point, we decided to do what's called an upper GI study. The upper GI is when we give barium, which is a material that shows up great on an x-ray. The dog swallows it and it shows up in their stomach, and we would like to see it move from their stomach to zoom, zoom, zoom down to their rectum, and they poop out barium. Well, this dog's upper GI study, the emptying of the stomach was very slow, And when the barium finally did leave the stomach, it revealed that there was actually material in the stomach and in the very first part of the small intestine that didn't belong there. It didn't show up on the plain view x-ray, but the barium coated this material and showed us that there was foreign material in this puppy, 8-month-old dog. So it was time for an exploratory surgery to find out what is it and can we remove it and what's going on. So that's exactly what we did. We came in on Sunday, because that's when it had to be done, and found that there was material in the stomach. We did a gastrotomy and pulled out a portion of a chewed up plastic bottle, a regular water bottle. There's a piece of it about maybe that big that had been chomped into little sharp shards that was stuck in the stomach. Then we pulled out the intestines and ran our whole length of it, and we found that there was additional material in the duodenum, at the flexure where the duodenum turns a corner and becomes a jejunum, and then further down the jejunum. So there was 3 pieces of water bottle in the intestines. And it turned out that the 2 leading pieces were tangled up with a fibrous string. Did you ever figure out what that was? Some sort of coarse fabric type material was tangled around the 2 sections of the water bottle. And unfortunately, what happened is as the intestinal tract with its peristalsis was trying to pull this material towards the rectum, one piece was stuck here, the other piece was going downstream, but it was being held by the string, and the string rubbed back and forth and acted like a saw cutting into the wall of the intestine. So at the level of the duodenum, we made an incision, we removed the foreign material, we sewed that one up. As we took the next section of the flexure out, the intestine ruptured, and now we had intestinal contents on our sterile drapes. This is not ideal. And as we looked closely, we saw that not only was the intestine red and inflamed, but there were areas where it was necrotic and dead because the sawing action of the linear foreign body had cut holes in the intestine. So we decided that the best way to deal with this, because it wasn't just one spot, it was multiple spots, would be to remove a section of the intestine. So that's what we did. We had already done our gastrotomy and closed that incision. We already did our enterotomy of the duodenum and closed that incision. And now we decided to do a resection, meaning you cut out the intestine, throw it over your shoulder, discard the dead and necrotic bowel, and then take the 2 ends now of the intestine and sew them together. And the term for that is anastomosis. So we did a resection and anastomosis. And then we cleaned everything up because we have bowel contents, which means bacteria, which we don't want in the abdomen. So we cleaned and washed and rinsed and woke her up, managed her with IV fluids, with pain medication, lots of antibiotics. And she was here yesterday, up and wagging her tail and getting her catheter removed. Yeah. So she did great. She did great. It looks like she's going to anticipate that she'll make a full recovery. After we did the multiple incisions in her intestine, we kind of did a sneaky fun thing. We took a piece of the intestine that was the next bit of section downstream, that healthy, normal intestine that had this wonderful pink blood supply, and we took that intestine and we brought it right up next to the sad, bruised, unhappy, I have multiple incisions portion of the intestine, and we made them friends. And we used a small amount of suture to tack them together. The benefit of that is that scars will form, and we got to choose where the scars form, and we made sure that there was a nice curve of intestine so it wasn't a tight bend. And when that scar forms, the neighboring intestine will lend a blood supply to the sad intestine. And that's what's going to help it heal, and that's why she's getting better quicker than she would if she had to create this on her own. So the term for that is serosal patching, where you take some neighboring healthy tissue and you bring it up next to the sad tissue so it can share blood supply. Yeah, question?
Are we anticipating that she will be completely fine and she won't have any dietary?
Part of the big concern of this surgery is the duodenum, the first bit of the small intestine, has a lot of important features. The pancreas runs right up and down the length of it. The ducts that go from the pancreas to the intestine are right there, and the common bile duct is right there. And the duodenum was kind of sad. because this 1, 2, 3 pieces of plastic had crumpled its way down there. I think it's going to be fine because there weren't any areas of necrosis in the duodenum. Right at the flexure, it was kind of sad looking, but we decided to keep it on the instinct that it would heal, and it appears that it is healing up. So once she gets through the post-op period, she should be able to eat dog food just fine. She might have trouble passing socks and underwear. Hopefully she won't try that. Yeah. Okay, good.